Hello, everybody. It is Mike Gatteri with MyInsuranceClassroom.com, and today we are bringing you another Health Insurance 101, trying to teach you everything about the world of insurance so that you can be as knowledgeable as possible when it comes time to picking a plan. Today, we want to speak to those parents and those children, if you will, who are coming off of their parents' plan. If you are that 25-year-old getting ready to turn age 26, or you're the parent of that 25-year-old getting ready to turn age 26, we want to give you a brief tutorial on how to, where to, and what to do when it comes time to shopping for your new plan. Okay, so let's jump right in and talk about exactly what you should be doing. So first and foremost, if you are age 25, getting ready to turn age 26, know that you will be able to stay on your parents' plan until the end of the month that you turn age 26. So if you turn 26 on August 15th, you will be covered through the end of August, and you will need to get a new plan on September 1. So presumably, if you're getting ready to turn age 26, this is the first time that you have ever had to shop for health insurance in your life. So what do? It can be overwhelming. It can be confusing, and you certainly don't want to get it wrong. So I want to give you a couple pieces of information that will hopefully make this process easier. First, I want to make sure that you focus on having access to care. What does that mean? It means that you're going to be able to see the doctors and hospitals that are going to be important for you when the proverbial stuff hits the fan. Yes, we want to make sure that your current doctors are in network. Yes, we want to make sure that the local doctors are in network. But if you need to go to the best facility in the country, I want you to be able to go there. I want you to be able to go to Cleveland Clinic, to MD Anderson, to Sloan Kettering, to all of the elite facilities across the country. And if you can get onto a plan that's going to give you access to those locations, they are worth their weight in gold. Hopefully you never need them. But you know what? If you ever have something rare that pops up, I want you to be able to go to the doctor that's absolutely best in the country, not the doctor that's 2 miles down the road. So certainly give that a lot of thought, because it is absolutely my number one tip when it comes to picking a plan. Number two, get the plan that's right for you. The plan that's right for your parents might not be the plan that's right for you. Oh, by the way, if your parents got their plan through their employer, your parents didn't even get to pick their own plan. They were told what plan to get because their employer picked it for them. You need to pick the plan that's right for you. If you're 26 and you're healthy and you're working out a lot and you're active, you may not need the lowest copays. You may not need the lowest deductibles. You might need a plan that's more focused on injuries than on illnesses. But get the plan that's tailored for your particular situation. Understand that insurance is expensive. Every city, the tallest building in the city, is an insurance company, because insurance companies are good at charging people premiums for things that they're not going to use. So buy the plan that's right for you in your particular situation. Well, what should that look like? My next tip, focus on the big stuff. Don't worry about the small stuff. Your doctor office visits are really cheap. Most doctors only charge between $100 to $150 for a doctor office visit. You having a copay of $30 really doesn't mean a whole heck of a lot of a savings to you. But the insurance company is going to charge you a lot for that. Having that $5 or $10 copay for your scripts is going to cost a whole heck of a lot. And quite honestly, if you're only going to the doctor once or twice a year, if you're only getting 1 or 2 scripts a year, you're going to pay so much extra for those little things. It's really, quite honestly, not worth it. Focus on the big stuff, the hospitalizations, the surgeries, the emergency rooms, the major tests. While they don't happen often, it's the stuff that breaks the bank. So those are the things that you want to make sure that you're really protected for, because that's what's going to cause financial ruin. So if you have to pick between having all the coverage in the world or just having the big stuff, focus on the big stuff. And if you have to focus on having either the big stuff covered or the little stuff, don't even worry about getting the little stuff covered, because that's not going to be what causes your financial hardships. Next, I want you to find someone that you trust who can help you with this. Might be your mom, might be your dad, might be your neighbor, might be a local insurance agent. But find someone that knows the industry. Find someone who has dealt with this and knows what you should be looking for and ask them to help you out. But then have them review it every single year. The industry changes every single year. Your health might change every single year. You might get married, you might have kids, you might move. All are reasons that you need to shop your plan. So every single year, do a policy review. Every single year, talk to someone you trust who knows the industry. Not someone who says they know the industry, but talk to someone who truly knows the industry and is going to have your best interest in mind. You need an advocate. This is cumbersome stuff. It's very difficult. Don't do it alone. Don't do it on the internet. And don't let a telemarketer of the world call you and convince you that the plan is amazing, because guess what? If it sounds too good to be true, it is. There's no good plans out there that have zero deductible. There's no good plans out there that have a $5 copay. All of those plans are going to be a bait and switch that the telemarketers of the world are trying to sell you. So be very, very careful when it comes to picking a plan. Lastly is learn your terms. A lot of them you don't want to learn, but guess what? You have to. What's a deductible? What's a copay? What's coinsurance? The most important term you need to learn: what is your maximum out of pocket? What does that mean? That's your worst case scenario. If something really, really bad happens, what is your maximum out of pocket? Guess what? When you talk to the telemarketers of the world, they won't tell you about the maximum out of pocket because there isn't one. That means if you have something bad, you pay unlimited. Your exposure is never going to stop. You need a plan with a true maximum out of pocket. That is your worst case scenario. And that term and that number are the most important thing that you need to focus on when it comes to the structure of that policy. But do you want to know what a copay is? We've got a video on this website. You want to know what a deductible is? We've got a video for that on this website. If you need to learn more about the industry, we're here to teach you. MyInsuranceClassroom.com. We want to make sure you're educated on everything. Oh, by the way, if you need to get a hold of us, you can reach us 614-749-9898 or 313-717-5513. I'm Mike Kateri. This has been another Health Insurance 101. And remember, there are only benefits if you get something out of it.